Welcome back to the Talking Ketamine podcast. This is episode 75, Ketamine's Hidden Brain Networks.
Have you ever wondered how a single infusion of ketamine can quickly reset a brain trapped in severe depression? By tracking high-order brain interactions, researchers found that ketamine synchronizes distant regions into a shared, flexible signal. Remarkably, how much a patient's brain reorganizes into this shared state 24 hours later predicts their depression relief a full week out.
So to kind of set the stage for you today, our mission is to really unpack exactly what that shared flexible signal actually means, especially for the future of mental health care.
Right, because it's a huge shift in how we understand this.
It really is. We are looking at this fascinating new study that takes this, often abstract concept of depression and finally grounds it in measurable physical reality.
Yeah, which is so needed. Because when you read standard medical literature, the language, it can feel incredibly detached, right?
Oh, totally. You hear about like chemical imbalances or you just read through these mood scores on a subjective questionnaire. But the researchers in this specific study, they focused on a group where that abstractness completely vanishes.
Absolutely.
We are talking about 30 older U.S. military veterans, all aged 55 and up, and they are all dealing with treatment-resistant depression.
And, that demographic is such a crucial starting point for this entire conversation. Because when we talk about treatment-resistant depression, or TRD in this context, we aren't talking about someone who is just going through a rough patch.
Right, not just a bad couple of weeks.
Exactly. By definition, every single person in this trial is an individual who has tried at least 2 traditional antidepressant medications. And those medications have completely failed to bring them relief.
Wow.
Yeah. They're carrying a heavy, moderate to severe symptom burden. And given their ages, being 55 and older, and their histories as veterans, they have likely been carrying that immense weight for a very, very long time.
Just stuck in the dark for years. It's heartbreaking. And to understand why those standard daily medications so often fail them, we really have to look at what is physically broken. Or actually, maybe stuck is the more accurate word here, inside a severely depressed brain.
Stuck is the perfect word for it, honestly.
Right. Because from the outside looking in, for you listening, depression often just looks like profound sadness or, a complete lack of energy or this inability to find joy in anything.
Yeah, the behavioral symptoms.
Exactly. But from the inside, like on a neurobiological level, it is more like a series of brain circuits getting trapped in these incredibly rigid, repetitive feedback loops.
Yes, inflexibility is it's the absolute hallmark of severe depression. The brain essentially loses its natural dynamism. It just becomes incredibly rigid.
Right.
Because in a healthy, functioning brain, networks of neurons are constantly forming connections, sharing information to process an event, and then smoothly dissolving those connections so you can move on to the next task or, the next thought.
It's fluid.
Right. It's a very fluid, dynamic process. But in severe depression, there is this dominant, heavy, top-down control. The brain gets locked into a very narrow, incredibly negative pattern of processing both internal thoughts and external information.
I was actually trying to visualize what that physically feels like for a patient, just to bring it down to earth. And the best way I can describe a depressed brain in that rigid state is, okay, imagine you are driving an old, really heavy truck, right? With incredibly tight, completely rusted steering gears.
Whoa, I like this.
Yeah, so you're driving down this muddy road and you hit a deep rut. And because the steering wheel is completely rusted shut, you cannot turn it.
You're just stuck in the track.
Exactly. You are entirely at the mercy of the rut. You are forced to just stay in that same deep track, playing out the exact same negative thought loops over and over again. And honestly, the real tragedy of standard daily medications like your traditional SSRIs and things like that is that they often take weeks or even months to build up in your system.
Right, they're notoriously slow.
And even when they do finally build up, for a lot of people, especially these veterans, they never actually break those rigid loops. They might make the ride a little smoother, like, putting better shocks on the truck. But the steering wheel is still rusted stuck.
That is a brilliant analogy. And it perfectly sets up why the intervention we're discussing today is fundamentally different from traditional pharmacology.
Because ketamine is fast.
Incredibly fast.
Yeah.
Ketamine does not take weeks to build up. It's a rapid-acting intravenous infusion. And instead of just trying to gently coax the brain out of the rut over a period of months, it rapidly loosens that rigid top-down brain control.
Built-in DOB40 for the brain.
Exactly. It acts as an immediate, powerful lubricant on those rusted steering gears. So suddenly, Isolated neural regions that were trapped in their own rigid little loops are disinhibited. The rust flakes off, the wheel turns, and those regions start communicating freely again.
Wow.
Yeah, the brain regains access to a much more flexible, open state of being.
So it's lubricating the gears so the mind can finally explore new paths. I mean, that makes so much sense. But, knowing that abstractly is one thing. What makes this particular research so exciting for us to talk about is that they actually witnessed this happening in real time, right?
They did. They moved this from a theoretical concept into measurable, quantifiable brain activity.
And I really love how they designed this trial because they didn't just use, like, saline for the control group.
No, which is a common issue in psychedelic research.
Right. So they set up a randomized double-blind trial where one group got a 40-minute ketamine infusion, but the other group received midazolam, which is, it's a sedative, right?
Yes, a benzodiazepine sedative.
That is so smart because if you give a patient a saline drip, they're instantly going to know they didn't get the active psychedelic drug.
Oh, 100%. The placebo effect vanishes immediately.
Exactly. So the sedative makes the control group feel sleepy and really relaxed, which preserves the blind nature of the study. But it absolutely does not trigger those massive neurobiological network changes that ketamine does.
Right, it's a vital piece of the methodology. You have to ensure that the patient's psychological expectation isn't, skewing the data. By using an active placebo like midazolam, the researchers isolated the actual physical effects of the drug.
So clever.
So, with the patients hooked up to EEG monitors, the researchers started looking at something called high-order interactions.
Okay, here we go into the science. Break it down for us.
I will keep it simple, don't worry. They were specifically looking at how different regions of the brain balance isolated information processing with shared information processing. In complex network theory, this is often described as the balance between synergy and redundancy.
Synergy and redundancy.
Yeah, which I know can sound a bit academic, but it describes something highly tangible.
So to bring those terms down to earth for anyone listening, I like to think of that isolated information processing, the synergy side of things, like a massive corporate skyscraper with, let's say, 50 different security guards.
Okay, I'm tracking with you.
Normally, those guards are communicating on highly secure, totally separate walkie-talkie channels. Like, the guard in the basement is only talking to the loading dock, and the guard on the roof is only talking to the penthouse. It's very complex, and their information is strictly partitioned so they can do their highly specific jobs.
Right.
And in a depressed brain, this isolation goes into overdrive, right? The mind becomes rigidly compartmentalized, and different regions just stop cooperating.
Exactly. The entire system is still generating and conveying information, but it is highly fractured. The isolated regions are trapped in their own local loops, and they are not sharing the broader picture with the rest of the brain.
But then the ketamine enters the patient's system. And according to the data, it flips the switch completely away from those partitioned walkie-talkies.
It's a dramatic shift.
Suddenly, the entire system shifts into massive redundancy. So instead of secure, isolated channels, all those distant, fractured brain regions are suddenly tuned into the exact same unified town hall broadcast. They are all sharing the exact same open signal. It's like every security guard in the building drops their private channel and listens to the exact same broadcast at the exact same time.
That is precisely what the EEG monitors captured. At the 1-hour mark, right after the 40-minute infusion finishes, the researchers saw an absolutely massive spike in this shared, unified broadcast state.
Wow. Just a full brain broadcast.
Yeah, widespread areas of the brain that were previously isolated suddenly synchronized on a specific unified frequency, specifically in the alpha wave band. And I have to point out, in the scientific community, we rarely see effect sizes this large.
Really? Like
Oh,
statistically?
yeah. The Cohen's d, which is a measure of effect size, was 2.57. To put that in context, anything over 0.8 is considered a large effect.
Wow.
So 2.57 is, the sheer magnitude of this shift was an absolute earthquake in the data.
An earthquake.
It was an undeniable physical alteration in how the entire brain was operating.
An earthquake is the perfect word for it. It is incredible to picture that happening inside a patient's mind. Every single region suddenly dropping its walls and listening to that same town hall broadcast.
Right.
And it perfectly mirrors that idea of loosening that heavy top-down control we talked about earlier. When the brain shifts into this highly shared state, the usual strict hierarchies, those, rusted steering gears, forcing the patient into the same depressive thoughts, they are completely suspended. The barriers between different networks just dissolve.
It's a profound synchronization.
Yeah.
And it creates a unique state where the brain is no longer restricted by its old, deeply ingrained habits.
Okay, but as amazing as that 1 hour town hall broadcast is, it brings us to a really critical pivot in this
Well,
research.
I know where you're going with this.
Right, because knowing the brain enters this synchronized state is incredible science. But if you are a patient sitting in that clinic, or, you love someone who is struggling with treatment-resistant depression, you really only care about one single thing.
Does it work?
Exactly. Does this actually heal the depression, and when does that healing happen?
That is the ultimate question. And the answer requires looking at how the brain's network state evolves over time,
Hmm.
rather than just taking a single snapshot.
Right.
So the researchers didn't just measure the brain at that 1 hour mark while the drug was at its peak. They actually brought the patients back and tracked their brain activity at 24 hours. And then again at 7 days post-infusion.
Which makes sense because the brain obviously doesn't just stay in that massive town hall broadcast forever. I mean, if you were constantly receiving the exact same signal across your entire brain permanently, you wouldn't be able to function or process everyday life.
No, you'd be totally non-functional. It is a highly transient state. By the 24-hour mark, that massive unified broadcast quiets down. The brain begins to shift into a different type of structural reorganization, utilizing different frequencies entirely, like theta waves.
Yeah.
And then by day 7, the network reorganizes yet again, with gamma waves emerging. It is a very structured temporal progression as the brain tries to find a new equilibrium.
But here is the absolute breakthrough finding of the entire study, the piece that I think completely changes how we look at this treatment.
Yeah, this is the big one.
The researchers looked at the clinical depression scores of these veterans at day 7. They wanted to see who actually got better, who actually found relief from that heavy burden. And they found that the patients who achieved the greatest improvement in their depressive symptoms a full week later were the ones whose brains established the strongest shared unified broadcast at the 24-hour mark.
That's right. The most predictive factor wasn't what happened at the 1 hour mark. It was what the brain was doing a full day later, at 24 hours.
Okay, I have to push back on this a little, because on the surface, it feels entirely counterintuitive.
How so?
Well, at the 1 hour mark, that is when the drug is actually surging in the patient's system. That is when the data showed that massive earthquake, right?
Yeah.
That undeniable synchronization across the entire brain. So why on earth does the 24-hour mark matter so much more for predicting long-term depression relief than that immediate, explosive 1 hour peak?
It is a fantastic question, and it really gets to the core of how true healing actually works in the brain. Think of the 1 hour mark as the acute disruption. It's the loud noise of the drug.
Okay.
To use a construction metaphor, it is the demolition crew coming in with sledgehammers and knocking down the walls of those rigid, depressed networks. It clears the site. But you don't judge the success of a new building by the demolition phase, do you?
Ah, right. You judge it by the foundation that actually gets built the next day.
Exactly. The 24-hour mark is so crucial because it reveals how the brain is actively settling into a new, reorganized baseline without the direct force of the drug. By 24 hours, the ketamine is largely cleared from the system.
So it's all on the brain at that point.
Right, so if the brain is still showing this structured, shared communication at that point, it means it hasn't just snapped back into its old, rigid, rusted ruts. It is actively maintaining a more flexible, open state on its own. It is proving that it is actually utilizing the plasticity the drug provided.
That makes perfect sense. The 1 hour mark is the door being kicked wide open, but the 24-hour mark is the moment the brain actually decides to walk through it and stay in the new room.
And this ties into another incredibly fascinating observation from the study. The researchers also measured the acute feelings of dissociation that patients experienced at the 1 hour mark.
Oh, right. Which is what patients often describe as a floating sensation or, feeling entirely disconnected from their physical body, like the classic psychedelic-like experience of the infusion.
Precisely. They measured the intensity of that subjective experience, and they found that those acute feelings of dissociation at 1 hour strongly predicted the physical network features that appeared at 24 hours.
Hey, really? So the acute subjective trip experience is directly linked to the biological reorganization happening a whole day later.
It appears to be deeply intertwined, yes. It shows a profound link between the psychological experience of the drug, that distinct feeling of your internal boundaries dissolving, and the subsequent physical reorganization of the brain's networks. You cannot easily separate the subjective experience from the biological healing.
Man, it paints such a vivid picture of a journey for the patient. I mean, think about it. The infusion kicks off this profound town hall broadcast. The patient feels like they're floating as the rigid boundaries of their mind literally dissolve. And then over the next 24 hours, the brain settles into this new, flexible foundation.
Yes.
And if that flexible foundation takes hold, a week later, the heavy cloud of severe depression actually begins to lift.
And that specific transition, that critical window of flexibility at the 24-hour market, it brings us to some incredibly important real-world takeaways. It perfectly aligns with the concept in psychiatric research known as the rebus model.
Yes, the rebus model. It stands for relaxed beliefs under psychedelics. I've read about this in the context of other therapies, but it makes so much sense here.
It really does.
The core idea is that in conditions like depression, the brain is dominated by rigid, overly precise prior beliefs.
Right.
And for a depressed patient, those beliefs are absolute constants. Things like, I am worthless, or nothing will ever get better, or the world is an entirely hostile place.
Yeah, the brain essentially operates like a predictive machine. And in depression, it constantly predicts negative outcomes and immediately rejects any positive evidence to the contrary.
Because the steering gears are rusted. The brain only knows how to drive in that specific negative rut. It filters out all the sunlight and only sees the mud.
But what ketamine does, and what this massive spike in brain communication likely reflects, is a literal relaxing of those rigid prior beliefs. It lowers the precision of that negative predictive machine.
It takes the pressure off.
Exactly. Suddenly, that heavy top-down control is weakened, and the brain becomes highly sensitive to new incoming evidence. It is finally forced to update its internal models about the world.
Which creates this profoundly important window of neuroplasticity.
Yes, a vital window.
And this is why this research is so much bigger than just giving a patient a drug and, sending them home to watch TV.
Oh, absolutely.
If you have a patient whose brain is in this highly flexible shared state at 24 hours, the state where their rigid negative beliefs are temporarily relaxed and their defenses are down, that is the absolute optimal time for psychotherapy.
It is the golden hour, so to speak. The brain is uniquely primed to absorb new, healthier ways of thinking and processing trauma.
Because for the first time in maybe a decade, the patient can actually hear a positive interpretation of an event from a therapist without their brain immediately shutting it down as false.
Right.
The walkie-talkies aren't isolated in the basement anymore. The whole brain is tuned in to a new, healthier broadcast. It takes the physical, biological reset of the drug and anchors it with lasting psychological healing.
Yes. The biology provides the window, and the therapy builds the new architecture.
Which brings up a massive real-world implication for the future of this treatment.
Yeah.
How do we actually know if a patient's brain has entered that optimal window?
That's the million-dollar question.
Because right now, in standard psychiatric care, we rely almost entirely on just asking the patient how they feel. And if you've been severely depressed for a decade, it can be really hard for you to know if you're actually getting better in the first 24 hours. Your perception is completely skewed.
That has always been the historical challenge of psychiatry. We treat physical organs, but we lack objective physical biomarkers for recovery.
Right.
We treat the brain, but we ask the patient to grade their own healing. But the methodology used in this study points to a very tangible, immediate future. To track these complex brain networks, the researchers didn't use a massive, million-dollar functional MRI machine that requires the patient to lie perfectly still in a claustrophobic tube for hours.
Thank goodness.
Right. They measured these interactions using a relatively simple, low-density, 15-electrode EEG setup.
Just 15 small electrodes placed on the scalp. It is completely non-invasive and totally accessible.
Exactly. And because it doesn't require a massive laboratory apparatus or a specialized hospital wing, this points to a future of treatment that is highly scalable. We are talking about the very real possibility of using affordable, wireless EEG headbands in standard, everyday outpatient clinics.
Think about how incredibly empowering that is for the patient sitting in that chair.
It's revolutionary.
Yeah. Imagine you go in for your ketamine treatment on a Tuesday, and instead of just going home on Wednesday and agonizing over whether you feel like 10% less sad or wondering if the treatment was a total waste of money, you put on a simple headband in the doctor's office.
Yeah.
And your doctor can look at a screen and say, look, right here in the data, your brain networks have shifted into that shared state. Your steering gears are lubricated. The rust is breaking off. You get physical, undeniable proof that your brain is actively reorganizing toward healing.
It changes the entire paradigm of psychiatric care, from subjective guessing to objective personalized medicine. If a clinician sees that the 24-hour marker hasn't been reached, they might know immediately that the dose needs adjusting or that a different intervention is required right now.
Oh, that's huge.
Yeah, they don't have to wait 6 weeks while the patient suffers just to see if the symptoms magically improve.
It really takes the trial and error cruelty out of mental health care. You aren't just waiting in the dark to see if the medicine works. You can actually watch the dawn breaking in your own brain's electrical signals.
And that leads me to a final thought I want you to ponder today. We are so accustomed to the invisible nature of mental illness. We treat it like a ghost in the machine.
Wow, yeah.
But imagine a near future where mental health care completely moves away from those subjective questionnaires. What if your psychiatrist could look at a dynamic weather map of your brain's communication? What if they could point to that map and tell you that your mind is physically healing days before you even consciously feel the heavy cloud of depression start to lift?
It is fascinating to see proof that ketamine gives the brain a chance to break out of rigid patterns and communicate on a whole new wavelength.
Exactly. Celine's showing that a 24-hour shift in brain network redundancy predicts depression relief a week later, gives us a real, measurable marker for personalized ketamine care.
That offers incredible hope for patients seeking long-term healing. Thanks for listening to the Talking Ketamine podcast. We'll catch you on the next one.